Thank you very much, Dr. Chitra. I'll be taking up controversies in iatrogenic ectasia management. As you all know that there is LASIK is a great procedure. You have variants now in the form of SMILE, and you had surface ablation, etc. You have LASIK, which is Thank you very much. Can I have the lights off? I'll be talking about the management of iatrogenic ectasia, and as I told you that post LASIK, though the figures are not, can the lights be put off please? Though the figures are not fully reported, and especially from the Indian circumstances, the incidence could be as much as 0.04 to 0.9%. Incidence is tending to come down as the flap thickness has gone down, as also with the switching over of the SMILE technology. There are various risk factors that have been attributed to iatrogenic ectasia, and you would be aware of them, which include keratoconus, high myopia, low residual stromal breadth, excessive ablation, small optic zone, forme-fuste keratoconus, PMCD, and undetermined factors. It is good to use this. I won't go into the details, but the Randleman risk score is there. A good float, which gives you the posterior float, is also required. But despite all these scorings, there are surprises that happen. We have just reported a case of unilateral ectasia post-SMILE with absolutely all scores being normal. So there are these instances that happen, but I'll be concentrating on not what are the reasons as to why it happens, but what we can do to take care of them. So there are several options that a person has to manage this ectasia. And earlier, before we used to just put the patient on contact lenses, and it was the excellent introduction by Professor Theo Seiler of getting the collagen cross-linkage, that you are working on collagen cross-linkage, as you all know, which is UV radiation. In our experience, we have had many cases that we have done, and we have seen that the results, this is a combination of both the primary keratoconus as also the ectatic corneas following LASIK. So there is an overall flattening of the corneal contour, and the Kmax has reduced, especially in pediatric cases, up to an extent of even 6.9 diopters. The astigmatism has therefore also reduced, and the reduction in the pachymetry does happen. The cornea tends to become more compact, and the pachymetry does tend to go down, but then it tends to recover. There has been an improvement in the best corrected visual acuity, and you can see that more than 53.7 had one-line improvement and two-line improvement in 19.8, and about 27% remaining there. This is just a pie chart for the same. Now, what we have observed in cases of post-LASIK ectasia is that the response that you get in a keratoconus case with collagen cross-linkage is more predictable, and the stability is more. But in cases of CXL post-LASIK ectasia, the response is variable. I have today now come to a conclusion that which has been supported by others, that doing just a CXL in case of a post-LASIK ectasia may not be the answer. You need to do an additional strengthening procedure of the intracorneal ring segments. So the difference, one doesn't really know as to what is the difference, whether the difference in the penetration, whether it is intrinsic pathophysiological differences because of the flap being there, but the response is not as robust. There is the extra technique that has come, which is the accelerated cross-linkage, which came in with the Avedro system. We are doing it with our normal systems also, but the LASIK extra, as you can see in this particular, is when you are looking at a borderline cornea, or you're looking at a cornea which is really not the best of corneas, you would wish to do this particular technology, and that is the corneal cross-linkage during a LASIK procedure. So in this,
using a femtosecond laser or microkeratome, the flap is lifted. A normal excimer ablation is performed. Sufficient Vibex riboflavin is applied to cover the entire exposed corneal bed and allowed to diffuse. In only 60 seconds, Vibex penetrates the stroma to prepare for effective cross-linking.